Hello and welcome. In this video I'm going to show you how we avoid white lines and marginal leakage in our Class 2 restorations. One of the main challenges in the Class 2 restoration is a concept called C factor. C factor is the ratio of a restoration's bonded to unbonded surfaces. The bonded surfaces being the surfaces of the composite that are actually touching the tooth, the unbonded surfaces being the surfaces that are free to the air. High C factor, in other words a restoration with a large number of bonded surfaces, gives high stress. In other words, if you're bonding composite resin to a flat surface, as you would be, for example, in doing a direct resin veneer in an anterior situation, you would have quite low C factor. If you're bonding composite resin in a box form like you're doing in a Class 2 restoration, you would have quite high C factor. So therefore a Class 2 restoration creates quite a lot of stress, and therefore you're more likely to have defective margins, marginal leakage and sensitivity. Here you can see a photomicrograph of marginal gap formation. What's happened here is polymerization stress in a Class 2 box has caused the resin to pull away from the most weakly bonded surface. The most weakly bonded surface in a Class 2 box is usually the gingival margin, and the reason for that is usually the gingival margin is either very, very thin enamel or dentine. So let's look at some other causes of white lines and explore some potential strategies to avoid this. So if you look at this case here, this is an upper right second molar. I've actually placed a Class 1 restoration. This is one of my Class 1 restorations. And as you can see there, there's a white line distally. So what are the potential causes of this? There are two main causes of white line. There is adhesive failure, or the so-called resin separation, and cohesive failure, the so-called enamel peel. In adhesive failure, what happens is there's contamination of either the bond or the tooth structure during placement of composite resin. And then when the composite resin is placed and light cured, the composite resin polymerizes. As it polymerizes, it shrinks, and as it shrinks, it pulls away from the contaminated surface, and the resin either separates from the bonding agent or the bonding agent separates from the tooth, and we get a white line, and that will turn into a brown line as it stains over time. Cohesive failure is slightly different. What happens here is when we prep our tooth, most of us will use a coarse or medium diamond or carbide, and the reason why we use a coarse or medium diamond and carbide is because it's more efficient. But unfortunately, the coarse grit or the coarse carbide causes some fracturing of the enamel prisms at the margin, and then what happens is as you bond to those fractured enamel prisms and then light cure your restoration, the restoration will shrink, and as it shrinks, it tends to pull the fractured enamel prisms away from the main body of the enamel, and therefore we get white lines. So what is our solution? Our solution is twofold. Firstly, we need to flare the box forms for our Class 2 restorations, and secondly, we need to finish the margins with carbide burrs and chisels to remove those fractured enamel prisms under high magnification. In terms of burr selection for margin finishing, I tend to prefer to use a very fine carbide burr, the sort of burr you might use to finish composite resin. What they will do is to remove those chipped, fractured enamel prisms and give you a smooth margin, kind of like the margin you might give your lab for an inlay or onlay prep, and that is much less likely to give you a white line. We use those burrs in a 1 to 5 speed increasing handpiece at very low speed, about 3,000 to 5,000 RPM. And the reason why we use low speed is because it generates less heat, and therefore you're going to get less fracturing of the enamel prisms again. We also use a water spray for the same reason.